My mother knew my cycle. Okay.
She was brilliant.
No, let me tell you, my mother. If I can be half the mother she is,
yes,
then I will just check off all the boxes.
All these things.
Hi and welcome back to my channel. Yes, it is the continuation of the conversation you've been asking about, but this is Dr. Kihara and I responding to the things you want. Incidentally, this is a 3-part conversation. This is part 4, then 5, then 6. Stop asking me for part 10. Don't count like my son. 1, 2, 3, 10. Yeah?
It will come.
And I'm so happy you're back.
Thank you.
Can we get to it?
Yes.
Can we get to it? So I'm going to start with an email from a lady who is concerned about her missing period. And not just a missing period. I'll go straight to where she says, my question is, I'm 24 years old and my menstruation has been irregular since 2008. And throughout my high school, I had my menses at most 4 times. Then after high school, that's 2012, they vanished. So I went to the hospital and I was given some tablets, which I took for 21 days. Then I got my menses after the 21st day. That was on the 29th of August, 2016. After which I have never seen my menses. What could be the problem?
Carol, it's simple. And what's her name?
Jacinta.
Jacinta. I want to address her by her name. Jacinta, you're not the only one. A lot of women do suffer from irregular, erratic periods, which you have. And most of them actually have ovarian problems. Specifically, one condition we call Polycystic Ovarian Syndrome. Okay. Now, what characterizes it? For some reason, the ovaries are non-responsive. You have 2 parts to your menstrual cycle. The first half where you just produce estrogen. Yes. Then after you ovulate, then you produce estrogen and progesterone, and then you shed off. Yes. Now, for some reason in these ovaries, they don't ovulate. So you continuously get the ovaries growing and mushrooming and developing cysts, which is collection of fluid. Okay. Unfortunately, brings a ratio of hormones that is hogwash. Mix up.
All right.
Now, what can we do? What characterizes it?
She told me she was waiting for an answer on YouTube. And this was weeks ago. So I told her, you go straight to a doctor right now.
She's waiting, but she needs to take action. Yes. I think that's the message. Okay. Because once you've started your menses, we expect the normal pattern will be a cyclical monthly bleed. Yes. In this case, what happens? They get erratic bleeding. They tend to develop quite a bit of acne. Tend to form a nice little big middle girth. So they're a little bit chubbier. Develop some hirsutism, which is hair growth. Okay. That is in excess amounts.
Are you taking notes? Look at your sisters and your daughters.
But above all, because of this abnormal hair growth, they also tend to have a little bit of androgens swimming around. So they have to be a little bit cranky.
All right.
So mood swings, and unfortunately, when it comes to sexual contact, they're raving. Okay. Now, what do we do as gynecologists? Number 1, make the diagnosis. So we can do hormonal screening. We can also do ultrasound, which the best ultrasound really to pick it out would be a transvaginal ultrasound. Okay. And we'll find an ovary that is full of locules of cysts. Okay. So what do we then do? It doesn't mean every woman who has a cyst, it's abnormal. No. You can either do serial follow-up, do intermittent intervention, like what she got was medicines that would bring on the period. Yes. But first and foremost, lose weight. Wow. First and foremost, lose weight. You will tend to find the periods coming automatically. Secondly, the reason being, you tend to get a metabolic imbalance. And these are also the same women who tend to be prone to become diabetic later in life. All right. Or tend to have cancer of the uterus later in life, because they've not been having the cyclical shedding you anticipate. Wow. But when you find that you do have polycystic ovarian syndrome and also tend to have issues related to infertility, because that's very common, because then you're not ovulating. Yes. So we then put definitive interventions, either using drugs that stimulate ovulation, but in some cases we have to intervene surgically. Okay. So we actually poke little holes in the layman's language into the ovary, which kind of then sorts it out. And then releases. And then releases at least an area of weakness where the eggs can then pass through. Wow. So my message to Jacinta, don't panic. Don't think you're really abnormal.
No, you're not.
Just get a gynecologist to review you.
But also, and I need to ask you this, and we need to get on to the next issue, is that when you haven't seen your period for 3 years, why don't we act sooner? Just explain that thing to me.
Menses has got its own connotation. Some people associate menses with shame.
Oh.
Some people actually say, oh, that's a headache I don't need, so I'm comfortable the way I am. Unfortunately, as years roll on, then issues of motherhood kick in.
Yes.
And what I may have sorted out so much earlier,
when you were 20,
I'm now dealing with it when
you're 30.
You're 30.
Yes.
And you know the biological clock doesn't wait for us.
It's ticking.
Get to 35, I always tell ladies, we're on the other side.
Yes. Yes.
Eggs are not as robust as they were when you were younger.
Yes.
So for Jacinta, it's not too late.
No.
Just get us to see you, have a look at you. At the same time, get to know what's your reproductive plan.
Yes.
Because that's the other thing, Carol, we don't seem to do.
Oh, yes.
Plan when I want my babies, how many babies I'd wish to have, and therefore take care of all the other elements that surround that.
True.
We're pushing careers, we're pushing, I don't know, chasing the Kenyan coin.
Yes.
Now especially.
Yes.
But we need to really take a step back and ask ourselves,
what
as
do I
young women,
want? Yes.
what do I want?
When do I want it?
When do I want it? And with whom do I want it? Yes.
Yes, I keep telling people, love is not a feeling, it's a decision.
It's a decision.
And parenting is one as well.
Exactly.
It's one as well.
Exactly.
So what you just described is PCOS.
Yes.
Okay. So another question that came up, and came up in all the comments. Yes, we read all of them. All your comments. Yes. Painful periods.
Yeah.
We all are accustomed to the fact that we will have some, actually I like to say discomfort. I know earlier when I think about today and my teenagers and my 20s, it's definitely different.
Yep.
So let's talk about what's the threshold of pain?
Threshold of pain is very individualized. In fact, if I wanted to pinch you right now, and I thought I'm going to give you that mama's pinch, that one that we all knew, you already cringed. So we are all different.
Okay.
I think that's where I need to start. Our thresholds for pain differ woman to woman.
Okay.
But this is my message. The early periods, when you just begin your periods, you will experience some discomfort, sometimes even pain that keeps you away from school.
True.
So you kind of actually know my period is coming on this day. I'll start a painkiller today. So when it comes in, I'm actually tiding into it without a problem.
All right.
But when you have persistent pain, even during the menses, and lacking on even after, you must ask yourself what's going on.
All right.
And you can't ask yourself without coming to see us. Because one, Carol, you'll find that some girls, the hymen may be too tight.
Okay.
So I'm starting as a young girl with this hymen that is constricted, and there's backflow of menses, which of course will give you a retrograde pain.
Yes.
I may have fibroids, another little culprit. Fibroids can give you heavy, painful menstruation.
Yes.
I may have abnormal collections of my lining of the uterus outside of the uterus.
Yes.
So what we know as endometriosis, again, that can give you pain in the pelvis and even in other areas of your body.
True.
Now, you may have the lining even growing into the muscle of the womb. Now, that's a different name, but it's called adenomyosis. So when you get the periods, again, associated with pain.
Yes.
Now, we have to remember, whenever we are dealing with a young girl or a young woman, any sign of periods or bleeding, the first test we always do is a pregnancy test.
Oh.
Why?
Why?
I can get abnormal patterns of bleeding associated with a pregnancy.
Okay.
So I may be miscarrying and I don't even know that I was pregnant.
Wow.
So you're having this acute pain and you're wondering, where's this coming from?
Oh dear.
Or a pregnancy that sits in the fallopian tube. Again, excruciating pain.
That I hear is
where you can literally
pain.
Point with a finger where exactly it is.
Here.
It's here.
Yeah.
And yet it's an ectopic.
Yes.
So I don't take pain, and we should not take pain lightly.
Okay.
Now, when it progresses within the period and even after the period, think about other things like even infection, pelvic inflammatory disease. Maybe you got an STD or you had an infection that has spread into the pelvic region, or you've come from a delivery, or you've come as a post-abortion case, and you end up with infection climbing up or ascending. Again, that will give you persistent pain.
But I just want to make reference again, because I really have no other point, to my mom.
Okay.
I must have been about 18, if not 17. And I remember I was home for the holidays, and I had pain, and my mother thought, initially she called, my mother's one of those, she'll call home, back in the day, nobody had a cell phone. How is she? She's in pain. How is she? She's in pain. By 4:30, my mother came home and decided at that time, it's not a period pain.
Yes.
What was it? Acute appendicitis. I went into surgery within an hour of landing at Mata.
Exactly.
So this is the other thing, that my mother knew my cycle. Okay.
She was brilliant.
No, let me tell you, my mother, if I can be half the mother she is, then I will just check off all the boxes.
All these things.
But also we go back to something you said on your last video.
Yeah.
We need to take our daughters early to meet an OBGYN.
Very true.
We need to transition from pediatrician
to the obstetrician.
True. Yes, because now we can have these conversations easier with our daughters. Not that she's sitting there saying, I feel. Yes.
I agree with you 100%. And over and above, you know, when you've walked the walk with your doctor, it becomes not a doctor-patient relationship, but a doctor-friend relationship.
There you go.
I have millions of friends. Sometimes I'm even in the supermarket, I'm being told, that sukari has come from there. And I'm like, hello?
Yes.
Says, yeah, you saw me. You may not remember me.
Oh,
and I'm
my
like,
goodness.
God bless you. You know?
Yes.
So you actually make a lot of friends along the way. And number two, somebody really knowing what's intricate to you.
Yes.
Because I always say I'm in a privileged career. Because I'm dealing with the most personal bit
intimate
of you.
part of me.
Exactly.
Yes.
So when you have somebody who has given you that privilege, one, don't abuse it as a gyna.
No.
Two, walk with them, because there's a journey. And it's a journey that starts from your young youthdom to when you'll be reproductively active, to when you now go into the menopause age. Because each of these in our lifespan have got challenges that they present with.
Okay, let's talk about fibroids and the myth around them. Okay. It's no longer an unknown word, but it seems to be that it is believed that you have to be in your 30s or 40s or 50s to have fibroids, yet girls in their 20s do get fibroids. Where did the misconception that our younger daughters, our younger sisters can't have them?
I will not look at it as misconception.
Okay.
One, the acumen for screening is much better. So the technologies that we have today is not what our mums had or our grandmoms. Number two, depending on how soon you present yourself to the clinic.
Yes.
I'm supposed to do a head to toe. Okay. So once I get to the pelvis, a good doctor, one, would actually now say, okay, we need to examine your pelvic area. Yes. What am I really looking for? Are there growths related to the uterus? Are there growths related to the ovary? Are you having swellings in the lower abdomen? Yeah, so our sensitivity in picking up these things is even higher. Number two, don't forget we have things like family planning that are bringing you now into the clinic.
Yes.
We have the Hpv vaccination that should be bringing the girls earlier to the clinic. Yeah. So ideally, you should then get a thorough head-to-toe checkup.
But if you do see an OBGYN with your daughter and your daughter is 21, 22, 23 and has fibroids, that's not crazy.
No, it's not. In fact, we say it's an incidental finding.
There you go.
Unless it's causing a problem, then let it be.
Okay.
We know it's there. We will follow it up, manage and see what is it actually doing in your system. Yeah. So if I'm told you have a little tiny little peanut size fibroid, serially just follow her up.
Yes.
But if you're finding a girl at 29 and she's saying, I can't even get to tie my waistline because this thing is growing
it's growing
at an astronomical rate. Yes. Then I will rethink, is this something that we warrant to actually look beyond?
Yes.
So it's very individualized. Let me start there. Very individualized. Number two, what are the symptoms and signs it's presenting for you? Others just knowing it's there, let it lie.
Okay.
Let it lie.
This came up also, adult acne. I know that we are all very happy to be done with our teenagers because we're done with our acne. Adult acne would be what? In your 30s and 40s?
40s, yeah.
Yes. Why is this a concern for women?
Commonest reason, hormonal imbalance.
All right.
So ladies need to relate. What kind of family planning method am I using? Am I triggering hormones similarly like when you're pregnant?
Okay.
The way your whole system changes. A lot of the family planning pills are actually just mixes of different ratios of the hormones that do appear when you're pregnant. So acne is a problem. The other issue is hygiene. I will always go back to hygiene.
Wow.
When you have tons of makeup, ladies, in the house,
and you don't sleep in it.
Well, that's what most people will do. Hang out in it, get sloshed up in it, sleep in it.
Okay.
Hello, hygiene, hygiene, hygiene.
Yeah, clean your face.
Clean it off, moisturize, tone your face, and then sleep.
All right.
So let's look at hygiene practices. Then we also have to look at all these concussions that we're using. You know, we all buff ourselves, you know, like, I like making it funny because of the cars. So you're buffing your face once too often. So you're declogging your pores, but sometimes you're actually giving it too much exposure.
Yes.
So again, the risk of now getting bugs now sitting in place and developing acne, yet another problem. So this is where, then nutrition. Nutrition, and it starts with a glass of water. As basic as that. Drink plenty of water. Ladies, if you're listening, plenty of water. Drink.
Yes.
Drink and hygiene.
Yes.
The reason being, what is the best antioxidant? Water is the purifier of everything.
It is.
So plenty of water. So even your nutrition, and include fruits. Vitamin A, vitamin C, very important for the face.
Wow.
So when we start saying, go and see a dermatologist, please let's rule out some of the things that you need to have taken care of.
Yes.
Including PCOS. PCOS is notorious for giving a lot of breakout in
for
acne.
breakouts.
Yeah.
You see, ladies, I went through all your questions. Discharge came up time and time again.
Okay.
What is normal discharge? Is discharge good? Discharge, I mean, does it vary during our menstrual cycle? I know you talked about this, but please go back into that space.
No problem.
Yeah.
I will start with what's absolutely normal. And I said, you have the time you've just finished your menses, you're relatively dry. But by the time you're getting to ovulate, you'll actually notice you have a stretchy, clear discharge.
We used to see it in pictures. Yes, a little mucousy.
Yeah? I won't give you the medicine, but there's a spin test. Then towards the time you're going to get your periods, again, it becomes tacky.
Okay.
So it's not as stretchy, but tacky. Now, that's absolutely normal. But this is what's the rider. If you wear your knicker or your little pant, and you notice at the end of the day, you're staining the panty, that may signify it's infected.
Oh, wow.
2, if it starts getting a whiffy smell, that again is obviously infected. Now, for some ladies, you also have to relate it with sexual contact.
Yes.
Because you don't know your partner, or you may know your partner, or your partner may be having an infection.
Yes.
So if you have the common yeast infection, which we all know, it's whitish, it's tacky, doesn't have quite much of an odor, but you tend to itch quite a bit.
Oh, yes.
That's a yeast infection.
True.
Diabetics, HIV, anemic patients. Those are some of the women who will commonly keep coming down with yeast infection.
All right.
But even poor hygiene practices. What's the one that nags me? You've washed your panty, done a very good job. Where do you hang it? In a small little room that's not aerated.
I know.
And it doesn't dry. And you just
still
pick
wear it
the
while
mold and fungus of the wall. And add your towel to that. That's all yeast infection. Now let's go to a few of the STDs that we do know, the sexually transmitted infections. There's one called Trichomonas Vaginalis. Big word. But whenever you have a really fish-like odor, very yellow and pungent, fulminant infection, that's Trichomonas. It needs to be treated.
Quickly.
If your friend or your partner is complaining that they're actually having some yellowish discharge per penile coming out, in a lot of women it may be quiet, but you would actually be having gonorrhea infection.
Wow.
Chlamydia. Chlamydia is a stretchy, very clear, and a lot of women confuse this with a normal discharge. But it's very copious, whitish, clearish discharge. That, again, is not normal. Now, the discharge I will not avoid here is the discharge related to cancers, particularly cervical cancer. This is how it behaves. You will go for treatment, you come back, it comes back on again. You go for treatment, it comes back. It kind of never quite goes. But you will have a history of having had multiple sexual partners, early sexual debut. And when you do have sexual contact, a lot of these ladies tend to have what we call post-coital bleeding. So you have a sexual encounter and you have it followed with some bleeding that follows.
Are you listening?
Yes.
It's not normal to bleed after sex.
Exactly. There is an infection going on. Make sure you rule it out, or there could even be cancer. Be wary.
This segment was called Doctor. We will be back because we need to talk about the things you need to know. And this is all based on the questions you asked. That's why we've got a pen and paper.
Yep.
We're not joking. We're ticking them off as we go.
Exactly.
All right. So subscribe and come back. Yeah? She's Dr. Anne Kihara. Keep your fingers crossed for her. There's something we must celebrate with her very soon.
Hopefully.
Yes.